So we're not going to go back over supplies to gather and draping the patient and all of those things. At this point, I'm going to go ahead and start draping my patient as if I've already done perineal care and hand hygiene. Preparing your female patient is slightly different than preparing your male patient for catheter insertion. I'm again going to drape my patient with a sheet across the top of their body to ensure privacy and comfort. Positioning for the female patient includes bending of the knees in an upward motion. The patient should let their legs fall downward. As you can see, this mannequin's having a little bit of difficulty with that. But we are going to spread the legs apart so we have easy access to the perineum. If your female patient is cold or needs to be draped, you can again put the blanket up under the patient's leg, wrap one side with the blanket on the patient's bed, however, for the female, since their legs are elevated slightly, you want to wrap the opposite leg with another sheet. This prevents you from potentially contaminating your sterile field with the bottom part of your blanket. Once you have your patient positioned, you can begin opening your catheter kit. Again, I'm not going to discuss the specifics of opening the kit, as this is discussed in the video with the male catheter. Remember, if you notice when you're cleaning your patient doing perineal care that you need assistance, you can always have another nurse or an aide come in and assist you with the catheter insertion. Remember the proper technique for donning your sterile gloves. Grabbing the inside part of the first glove to don your dominant hand first. Then tucking your fingers under the cuff of the second glove and fanning out your thumb as you don the second glove. T-Rex arms at this point. We're again going to use the first drape in our kit to extend our sterile field, wrapping that around our hands and sliding it under the patient's bottom without touching the patient's legs or any part of the bed with our sterile hands. For a female patient, we do not use the diamond drape because of the potential for contaminating our sterile field. I'm just going to drop this off to the side. We're then going to set up our kit much like before. Again, your instructor will provide you with the Castile soap. To lubricate your catheter. Again, in real life, you would use the lubrication inside the kit, but for these purposes, your instructor will provide you with lubrication. Carefully take the sheath off of your catheter tubing, remembering to ensure that your catheter tubing does not flop. Lubricate 1 to 2 inches of the catheter tubing for a female patient. And again, I'm going to leave my tubing sitting in the lubrication ready to insert the catheter. For a female patient, we again visit our never let goes. Once you touch your patient, you never let go of your patient. If you touch the labia and clean and then let go, you have to clean again before you can insert a catheter. You want to pull the labia apart and visualize the urethra. At this point, you're going to take one of your swabs, clean down the opposite side, go around your sterile field, and let it go. Your swab. Take your second swab, clean down the side nearest you, and then go around your sterile field to throw it away. The final swab should be down the middle, around your sterile field to throw it away. Again, I'm going to remind you to never let go. Now that this is clean, if I let go, I would have to re-clean before I insert the catheter. I'm going to get my catheter tubing. Before insertion, I'm going to have the patient take a deep breath. Then I'm going to insert the tubing. As I insert the tubing, I'm going to look for urine output in the catheter tubing, in the clear tubing. Notice again that I'm not touching the patient with my sterile hand as I insert the catheter. Once you see urine return, you want to insert the catheter another 2 to 3 inches to ensure that you're all the way in the bladder prior to inflating the balloon. Once you're in, we do our second never let go. Continue to hold the catheter tubing with your dominant hand as you let go with your non-dominant hand to instill the sterile saline into the catheter's balloon. Gently pull back to ensure the balloon is inflated. And this is where we've had our third never let go. We never let go of the plunger of the syringe until we're ready to detach it from the catheter tubing. Once we detach it, we can let it go. At this point, you secure the catheter to the patient's leg like we talked about in the previous video, as well as hanging the bag on the bed frame. When you go to hang the bag on the bed frame, it's a good idea to go ahead and pull off your sterile gloves and put on a pair of clean gloves, just to ensure that if you had any body fluids or anything on your sterile gloves from inserting the catheter, that you don't get that on the patient's bed or on the catheter bag when you hang it on the bed frame.